Hello everybody, this is Gary. Today is April 29th, Friday 2022. It is 6:21 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today has been kind of rough with my paranoia. I went downstairs to do my laundry today. One of the elevators isn't working. There's hundreds of apartments in this high-rise building, and the elevator was crowded. I was trying to get off the elevator with my clothes on a wheeled cart. I was insulted and made fun of, and that doesn't help my paranoia. It makes me feel like people are judging me, threatening me, trying to hurt me, follow me, spy on me. I feel like I'm alone, totally alone. I sometimes don't feel safe anywhere, even when I am relatively safe. Sometimes I can't distinguish between reality and my psychotic delusional fantasies. I mean, there's no doubt that when I got on the elevator, it was overcrowded. There's 25 floors in this building. There's hundreds of apartments. There's hundreds of tenants. And with one of the elevators down, the elevator is always overcrowded. The elevator needs new cables, and they're not going to fix it for another 2 months. Generally speaking, I've been here for about a year and a half, and maintenance has been pretty good about making repairs in my apartments, getting rid of the cockroaches and mice and all that. But for some reason, they can't repair the elevator for another 2 months. So now the elevator's crowded, people are nasty to each other, they're rude to each other, they insult each other, they make fun of each other, and that's not my paranoia, that's just the way it is. But it does aggravate my paranoia in general, and increases my anxiety levels. So my anxiety levels are up very, 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 very high right now. I feel very angry and very agitated. I'm in control of my behavior. I'm not violent. I'm not suicidal. But this kind of shit doesn't help my paranoia. When something truly negative happens, it just increases my paranoid fantasies. It increases my auditory hallucinations. It makes my blood pressure go up. It makes my heart beat fast. It makes me sweat more. It makes my depression, anxiety, insomnia worse. I've generally had a peaceful time in this building, but there are very fucking rude people in this building. They don't know how to treat each other with any sense of dignity or respect or patience. But it's not my fault that the elevator isn't working properly, and people are insulting me like I did something to damage the elevator. At least that's what it feels like. I'm very angry and pissed off about it. So overall, today, my paranoia is worse, my auditory hallucinations are worse, my anxiety is worse, my depression is worse, my insomnia really hasn't been much of a problem. I've been sleeping better since I started the antidepressant Cymbalta, and my physical pain has gone down. My right knee, of course, is still bothering me because I was supposed to have surgery today on my knee for a torn meniscus and loose cartilage, but I tested positive on Monday for COVID-19, and they canceled and rescheduled my surgery to May 13th. And I have to do another COVID test on May 9th. I'm seeing my psychiatrist this Thursday. It's Friday. It's going to be a long weekend. I won't be able to talk to my therapist over the weekend on the phone if I need to. I don't think I'm going to the psychiatric emergency room anytime soon. I haven't gone to the psychiatric emergency room since October 30th of last year. So it's been about 6 months since I've gone there. My moods tend to fluctuate up and down. My anxiety tends to fluctuate up and down. My paranoia and hallucinations tend to fluctuate up and down. It depends on how much stress I feel like I'm in, how much physical pain I'm in with my right knee, how much stress I'm in just going through this fucking building and being treated rudely. I'm doing the best I can to cope. Now, if you're wondering what that white stuff on my lips is, that's nicotine lozenges. I haven't had a cigarette in about, I don't know, 3 months. So I'm still using nicotine lozenges to deal with the not smoking. My psychiatrist is prescribing the nicotine lozenges. My regular doctor, my primary care nurse practitioner, is prescribing the Cymbalta because I'm taking that primarily for physical pain. There are benefits from it as an antidepressant, though. So all my schizophrenic symptoms are worse today. Generally speaking, I feel like shit. I feel alone. I feel angry, bothered, agitated, deliberately insulted. And I'm going to take some Klonopin later with some Zyprexa, meditate, try to calm down, try not to ruminate when people treat me like they have to be an asshole. Some people are assholes. And that's not my paranoia talking. There's just too many people in this building and not enough elevators. And it just fucking pisses me off. So I'm seeing my therapist I believe on the 10th of May, which is 2-3 days before my surgery. And I'm assuming that I'm going into surgery, assuming my next COVID test isn't positive. Because if it is, I have a feeling they'll cancel my surgery again. And I'm getting really pissed off about my right knee. This surgery should have been done a long time ago. I don't know. I just feel really agitated right now and insulted. There's nothing else to report right now. Like, comment, share, subscribe.